Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapano.
And it is Sports Doctor. Tonight we're brought to you by Cross Keys Physical Therapy, Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro, offering free screenings for the next 2 weeks. We'll give you numbers to take advantage of that offer. Right now we're offering free consultations right on the air. Our toll-free number 1-888-634-7488. We're calling out to people who have shoulder and knee problems, because that is our topic tonight, shoulder and knee injuries. If you're having problems with your shoulder and or knee, our toll-free number 1-888-634-7488. Call us up. We'd love to hear from you. Answering your calls tonight, we have Dr. Mark Pollard. He is an orthopedic surgeon with a sports medicine specialty. He practices with Cooper Bone and Joint Institute, locations in Camden, Cherry Hill, and Voorhees, also Newtown Square, Pennsylvania. Next to him, Dave Anselmo. Dave is a physical therapist and also the owner of Cross Keys Physical Therapy Sports Medicine Center. As we said, they're in Sicklerville, Woodbury, Washington Township, Vineland, Swedesboro, and Pennsville. Again, our toll-free number 1-888-634-7488. While we're waiting for your calls, we'll take a look at the anatomy of the knee joint. Dave?
Sure. Let's start out here. This is a right knee. Let's start with the bone first. This is the femur. Okay. This is the tibia. This is the fibula. Right here, this is the patella. This is the superior patella tendon. This is the inferior patella tendon, which is torn. It's the lateral collateral ligament. This is the medial collateral ligament. And now let's go inside the knee where everything seems to be happening. Or is happening here. This is the lateral meniscus. This is the medial meniscus. This is the anterior cruciate ligament, or known as ACL. When we turn it around, this is the posterior cruciate ligament, known as PCL. That's the basic anatomy of the knee joint.
And a lot of things can go wrong. We'll talk about some of the more commonly injured structures in just a few moments. Right now, though, let's go to the phone lines. Our toll-free number, 1-888-634-7488. I believe the first caller's name is Glenn from Philly. Glenn, welcome to Sports Doctor. What's your question for us tonight?
Hello, good afternoon, or good night, good evening. I'm calling in conjunction because on my left leg, I have like real severe sciatica pain. I had 2 injections, and they seem not to be working. And I just want to find out what other avenues I can go about of trying to get this pain alleviated.
Okay, the sciatic nerve is actually not part of the knee, but do you have some comments there?
Yeah, basically for a sciatica type pain, and I'm sure that if you've gone through some injections, you've already consulted with a couple of physicians. Basically the condition is caused by a pinching of the nerve in the back as it's trying to exit the spinal column. You get the referred pain going down the leg. Classically, that pain will go past the knee, and you will end up with some weakness as well. And the treatment options, the mainstay of treatment is actually physical therapy, which I'm sure Dave can speak to a little bit. That seems to be very successful in treating most cases, as most of the pinching of the nerve is caused by some intermeniscal disc, that soft tissue that's in between the vertebrae, as it can herniate out and pinch against the nerve. Over time, that disc tends to dry out and decrease in size, thus decreasing the irritation and pinch on the nerve. In other cases, you can try to do some injections. I'm sure you had, I believe it's epidural injections. Those also seem to help sometimes. There are surgical options for which include taking the disc out, basically mechanically removing the pinch that is on the nerve. But this is usually reserved for only cases that time, physical therapy, and injections really don't help.
Let's talk about the physical therapy approach. Dave?
Well, once again, I think it all starts from a thorough evaluation, as the doctor nicely explained, because as you can see, it can be coming from many different areas. It could be coming from the spine. It also could be coming from the area where it comes, it axis out of the spine, goes through the gluteal fold, it comes down that area. It can become impinged there as well. So a thorough evaluation really to find out where you're being impinged at is very important to be addressed, so we can make sure we're addressing the right area. But mostly, really, what you're really doing is you're trying to break up some of the scar tissue because it adheses onto the soft tissue. So in physical therapy, we're doing things like ultrasound to try to break up the scar tissue because we know ultrasound has a tendency to break up collagen, and that's what scar tissue is made up of. So we do ultrasound. We do a lot of stretching to try to break that up, to prevent that adhesions from forming onto the soft tissue. And then we do electrical stim and some ice, and obviously we get you into some strengthening to get you back to your functional duties again.
All right, Glenn, thank you for the phone call. Our toll-free number, 1-888-634-7488. We're talking knees and shoulders, and Alan is waiting to talk to us from Trenton. Alan, thanks for waiting. Go right ahead with your question.
Yes, hi. My name is Alan Moore, and I have a problem with my left knee. And the question is, though, that I've been taking fish oil tablets and core calcium and different types of vitamins. And I just want to know what's the best solution to use, because sometimes it bothers me at night and sometimes during the daytime. My age is 50, but I just want to know what's your solution.
Okay, it's difficult because we don't actually know what the problem is, correct? But based on what he's telling us, what do you think, Doctor?
As your age is 50, and from what I'm understanding, it's not real clicking, popping, and catching where your knee joint gets stuck in a certain position, and it doesn't feel like the knee is giving out. It just hurts. Am I reading that correctly?
Yes, I just have pain sometimes going up and down the steps, or not when I'm walking, basically when I go up and down the steps.
Mm-hmm. It's very common to get some irritation underneath the kneecap, so-called chondromalacia patellae or patellofemoral syndrome. If you look at our model here, you have your the kneecap rides in this groove on the end of the femur bone. As the knee flexes and extends, the kneecap actually slides up and down in this area. And it's kind of a delicate balance. There's a lot of forces that go through this area. It doesn't take much to throw it off. And what happens is the backside of the kneecap, which usually has very thick cartilage, sometimes gets irritated and can get roughened. And you can actually sometimes feel that roughening as kind of crunching as you're straightening and bending your knee. Again, the mainstay of therapy for that kind of, or the mainstay of treatment for that kind of a problem is typically a good exercise program. Typically under the supervision of a therapist, we have a number of different protocols to try that are basically kind of focused on strengthening certain parts of the quadriceps muscle to make sure that they're in the correct balance, and also to stretch the hamstrings. And also there's a variety of modalities to try and decrease the irritation around that area. As far as supplements are concerned, there's not a whole lot of hard science behind them, but I typically recommend patients try to take glucosamine chondroitin, which is a supplement. It's over the counter. There's a number of different brands, and that seems to help out a lot of people as far as decreasing the joint irritation.
And I think next week we may be doing a show on supplements, so you might want to check us out next week for another edition of Sports Doctor. Right now we're talking knees and shoulders. Our toll-free number, 1-888-634-7488. We got Mike on the line from Narberth, Pennsylvania. Mike, go right ahead with your question on Sports Doctor.
Hi, good evening. Right now I'm 50 years old. I've got my left knee is got 30 years of damage to it. ACL, MCL are gone. The cartilage is worn away, and I'm more aggravated now with the right knee just toward the ACL. What they're starting to do, I'm perfectly, and I do glucosamine and chondroitin every day, but they go and they're looking at doing Synvisc. I've already gotten the prescription for Synvisc, but I'm hearing a lot of different reports on Synvisc.
Okay. Are there side effects with this Synvisc?
Just to catch everybody up, what Synvisc is, it's called viscosupplementation. It's an injection of basically ground up building blocks of cartilage. There's a number of different brands out there, and they get the product from rooster combs. They sometimes are able to genetically engineer it. There are some side effects to it, and the point, it does the same thing as the glucosamine chondroitin pills, except that it puts the substance right in the knee joint. The thought is, again, to decrease joint irritation. You can have some side effects, and they've been reported. Sometimes people do get some local irritation with it. Many times, for instance, the products that are obtained from rooster combs, you don't want to have if you have an allergy to egg or poultry products, because that puts you at an increased risk for a kind of response. And some people also occasionally have an inflammatory response. By and large, though, these series of injections are fairly well tolerated with minimal side effects.
And again, I hope I'm not talking out of school here, but I believe next week we are going to focus entirely. I am talking out of school. Okay, that won't be next week. Future show coming up, I'm sure we'll be talking about supplements, so we invite you to join us. Right now, we are talking knee and shoulder joints. We've got John on the line. We'll take his call next. Also, your call. Our toll-free number, 1-888-634-7488. Before we go to break, though, let me tell you about Cross Keys Physical Therapy Sports Medicine Center. They're located in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro, and they're offering free screenings for the next 2 weeks. There are the numbers for the center nearest you. Just call and make an appointment. It's that simple. Take advantage of that offer. And we'll come back with more of Sports Doctor. Again, our topic, knee and shoulder injuries. We'll take your phone calls too. Stay with us. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
All right, welcome back to Sports Doctor. My name is Joe Chipana. Tonight we are talking knee and shoulder injuries, and we welcome your phone calls. If you're having problems with your knee or your shoulder, you wonder what's going on, you want to talk to some professionals, our toll-free number, 1-888-634-7488. We'll let you talk to Dr. Mark Pollard. He is an orthopedic surgeon and also a sports medicine specialist. He's with the Cooper Bone and Joint Institute. They're located in Camden, Cherry Hill, Voorhees, and Newtown Square, Pennsylvania. Also, Dave Anselmo. Dave is a physical therapist and also the owner of Cross Keys Physical Therapy Sports Medicine Center. Again, our toll-free number, 1-888-634-7488. John from Philly is our next caller. John, if you're still there, go right ahead, buddy, with your question.
Yeah, I do a lot of running. I seem to be suffering now from the IT friction syndrome. Do you guys have any suggestions as to what you can do to alleviate that?
Okay, first of all, can we explain the IT syndrome? Because I'm not familiar with this at all.
You want to do it? I want to do it.
You can go ahead.
Dave, you want to grab it?
Well, it's the iliotibial band syndrome. Basically, what the iliotibial band is basically a band that it comes from the hip and it comes down and it attaches along the area here. And also, let's go here. It comes along the area here, it comes up to the hip, and it comes down and attaches along here. And some of the soft tissue attaches onto the patella. And so it can pull this patella laterally, as you can see on this model here. As the condyle on this side is larger, it stands out, protrudes further on this side, it will hit this condyle here and pull this out here. The tightness of the iliotibial band creates a problem. And really, the main thing you really need to do is you really need to stretch that. You really need to stretch that iliotibial band as much as you possibly can and be persistent, especially if you're a runner. You need to do that before you run, and you need to do that after you run. I think that's the #1 thing I think a lot of people avoid doing is after they get done running, they just stop running. You need to stretch again after you get done running to cool down, and also if you're having a problem with it, you need to ice it down as well. So if you're having a problem with the popping in the knee, the condyle there, you need to go and get it checked out because we need to strengthen your VMO, which is your medial musculature, to allow that to pull that patella more medially and prevent it from hitting this area too as well. But your IT band needs to be addressed first.
All right, thank you for the phone call. Toll-free number, 1-888-634-7488. Let's go to Tom's River. Raymond, you're on Sports Doctor. What's your question for us?
Hi.
Hi, Raymond. Go ahead.
I had both my knees are obstructed. I got the grinding on my knees, and I got 2 cysts behind my knees, and I can barely walk. Now, when I walk and I feel they start grinding, like you try grinding, and when I walking on the curves, together, I can't even walk the curves. What do you think? What do you think more problems with the grind?
Is he talking about the Baker's cyst? Is that what he's talking about?
I think that's probably what he's getting into. From what I can gather, it sounds like you've probably got some arthritis in there. How old are you, sir?
Excuse me?
How old are you?
Yeah, it's like grinding. Like I walk 5 minutes, I can't walk.
Raymond, what's your age?
44.
44. Okay.
Okay. Many times, you know, that the grinding you get could be a tear of the cartilage. Sometimes, if the meniscus is torn, a piece of this cartilage can flip out, get in the way, and can act like a wrench in the gears, and can cause you to have some grinding and mechanical type symptoms. Although arthritis, which is a wearing away of all the joint surface cartilage, will also cause you to have a lot of grinding as well. The cyst behind your knee most commonly is a Baker's cyst. It's a collection of fluid. It's basically a product of irritation inside the knee joint. What happens is there's irritation in the knee joint. The knee has two ways of letting you know that it's irritated. It hurts and it can produce fluid. It produces this extra fluid and it pushes out this potential weak space in the back, and you end up with this kind of one-way valve, and the fluid collects back there. The cyst gets bigger and smaller. Many times we don't do anything about the cyst. Typically you don't do surgery to take it out. You try to take care of the problem inside the knee joint itself to prevent the fluid from being produced.
All right, Raymond, thank you for the phone call. Good luck with that. Our toll-free number is 1-888-634-7488. We're talking knee and shoulder injuries, and I believe we have Eric on the line from Philadelphia. Eric, go right ahead with your question.
My question is, I hurt my knee, and I did an MRI. They say that I have a partial thickness cartilage defect with a flat configuration at the medial femoral condyle. It's a small right knee infusion. What would help me to get, like, my knee better? Would surgery be a consideration, or rehabilitation on working on the knee and making it stronger?
All right, Dr. Pollard, what do you think?
Most of the time, you told us there was a partial thickness problem with the cartilage. Most of the time, if there is some cartilage left in this small area, we don't recommend surgery right off the bat. What you do is you try and decrease the irritation. Most of the time, a good therapy program, good exercise program, and perhaps trying some of those supplements that we talked about, like glucosamine chondroitin, again, that seems to do a reasonable job of decreasing irritation. Also, anti-inflammatories do help.
All right, thank you for the phone call. Our toll-free number, 1-888-634-7488. We're going to do that supplement show soon, I promise. Right now, we're talking knee and shoulder injuries. Let's go to Gil in Maple Shade. Gil, thank you for watching. Thank you. Oh, I'm sorry, it's Bill. I'm sorry. Bill, go right ahead with your question on Sports Doctor.
Yes, good evening. My name is Bill. I had an MRI done on my left knee. I have a cleavage tear of the posterior horn and medial meniscus. I tried physical therapy for approximately 4 weeks. I'm still having pain in my left knee, mostly in the back of the knee, which shoots up the hamstring, and my knee does pop out periodically. My question today is, I guess, is surgery the next route, since I did try physical therapy?
Okay, Dr. Pollard?
Well, from what it sounds like, a cleavage tear of the meniscus typically in and of itself is not necessarily a surgical indication, because most of the time that kind of a tear doesn't lend itself to having a loose piece flopping around. That does not mean that there isn't a loose piece that just happened to be in place when you had the MRI. 4 weeks is a little bit of a short course as far as the exercises are concerned. I like to see people go through, at least a month of physical therapy and at least 12 weeks total of doing the exercises on their own or going to the therapist, just to see if we can't get that irritation to go down. Because you want to try and save meniscus if you can.
Yeah, plus the fact that you mentioned something that once in a while it pops out. Is that correct?
I think Bill did.
Well, it's the fact that it's still popping out. It tells me a little bit. He has a little muscle imbalance as well there, which needs to be addressed. And I don't know what type of therapy you're receiving, but anytime you have a problem with your meniscus, it doesn't seem to be being accelerating by physical therapy itself, but you should really look into going into an aquatic therapy program as well, because it helps to decompress that area a little bit more and allows us as therapists to be a little more aggressive, because at Cross Keys we have 3 aquatic therapy centers, and we'd like to take advantage of that because it decompresses the joint. We know at waist level we're decreasing the weight-bearing effects by 50%, and then at shoulder level we're decreasing it by 90%. Our therapists are in the water with you, and we're actually stretching you and showing you exactly what we want you to do as far as at home, but also strengthening you a lot more aggressively. We're doing these exercises in an environment where your knee is decompressed by a tremendous amount, raised, like I said, at 90% at shoulder level.
Okay, we have like a little footage of that in the beginning of the program of aquatic therapy, offered in the Woodbury, Washington Township, and Pennsville offices of Cross Keys Physical Therapy. Again, those locations in Sicklerville, Vineland, and Swedesboro offering free screenings for the next 2 weeks. Call them. Take advantage of this offer and have someone look at what's causing you pain and see if it could be worked on. Check that out. Take advantage of that offer. Don't forget, we are Sports Doctor. We're talking knee and shoulder injuries. We want to hear from you tonight. Our toll-free number, 1-888-634-7488. Susan from Fairless Hills will talk to you next. Also, more of your phone calls right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
I will be.
I will be. I will be.
I will be a pro.
A professional athlete.
A gold medalist.
If you want to be a pro, then train like a pro. Hi, I'm Mike Quick, and I've joined the Velocity Sports Performance Team powered by the Rockman Institute. The highest levels of competition require more power, more speed, more agility. Here at Velocity, we train athletes of all ages and skill levels in these specific areas. Come in for a free training session and see how you can maximize your potential.
Welcome back to Sports Doctor. I'm Joe Chapana. Tonight we're talking knee and shoulder injuries. If you have a problem in those areas, call us. Our toll-free number, 1-888-634-7488. Would love to entertain your question. Joining us, we have Dr. Mark Pollard. He is an orthopedic surgeon, sports medicine specialist, Cooper Bone and Joint Institute located in Camden, Cherry Hill, Voorhees, and Newtown Square, Pennsylvania. Also, Dave Anselmo is here, physical therapist and owner of Cross Keys Physical Therapy. That is him in the pool, offering aquatic therapy, which they do there. And they're located in Sicklerville, Woodbury, Washington Township, Vineland, Swedesboro, and Pennsville. Knee and shoulder injuries, toll-free number, 1-888-634-7488. Susan from Fairless Hills, if you're still there, go right ahead with your question on Sports Doctor.
Hi, I was diagnosed with frozen shoulder, and I've been through physical therapy. My question is, it has gotten probably about 75 to 80% better. I recently was doing some heavy lifting and have started to have quite a bit of pain again. And I'm not sure whether on days like that, if I should keep up the exercises that I've been doing or...
Okay, this is a good question. Frozen shoulder, 75 to 80% better. Some days I guess she overdoes it. Should she immediately stop? Should she continue? What are your thoughts?
Just kind of catch people up. Frozen shoulder adhesive capsulitis is a condition where the capsule around the shoulder joint, here we have a shoulder model, but there's a capsule, a bag around the joint, that tends to...
We're switching models.
Yeah, that actually kind of basically has all the ligaments that control and stabilize the joint. In this condition, those tissues, for reasons that we don't yet understand all the way, tend to get inflamed and tighten up and contract, and they don't allow the shoulder to move and can be quite painful. The treatment that most of us try to pursue is actually non-operative physical therapy, which you've been through and seem to have had a reasonably good result from. This problem is very stubborn. It takes a long time to get better from, but most of it will get better without surgical intervention. It's very common to get a little flare-up, especially if you overdo things in the subacute phase as you're starting to get better. You should continue with the exercises, but only within the realm of what's comfortable. You shouldn't do things that irritate it and make it more painful. And I think Dave can probably speak to that a little bit as well.
Yeah, I think a very good suggestion by the doctor. But on my clinic, I really, with someone with frozen shoulder, they do very well. You got to be very aggressive with them because you're breaking up some of that scar tissue that the doctor nicely explained. It happens because your inflammation forms and adhesions start to form into the joint. We use a lot of ultrasound to break up that scar tissue, and we really do a lot of aggressive joint mobilization and stretching. We really generally don't really start on aggressive strengthening exercises till you really get around 90% of your range of motion back, because we really don't want to compress that joint again and cause any more inflammation to be to irritate it again. So we generally won't really start that until we get about 90%, and you really we're pretty good percentage. You should be able to get that back. You just need to be more aggressive. And the doctor said it's not going to happen in 3 to 4 weeks. It's going to take a good 12 to 16 weeks to really get that shoulder back to where you're getting to about 90% of range of motion back.
All right, Susan, thank you for the phone call. Let's talk to Gladys in Dover, Delaware. Gladys, go right ahead with your question on Sports Doctor.
Yes, my question is, when I take a nap in the afternoons and I bend my knees, then when I go to straighten my knees out, I have real severe pain right where my joints is in my knees, and it's very hard for me to straighten my knees out. And I was just wondering if you could tell me what that is.
Okay, we only got about a minute here. So.
It's difficult to tell. It sounds like you've probably got a meniscus tear. That's one of the most common symptoms of a meniscus tear is that when you get into deep flexion, it really presses on the back part of the meniscus, which is most commonly torn. And if there's a piece that comes loose, this piece may work its way loose and prevent you or make it difficult to get all the way straight. If this is happening to you on a regular basis and it's really getting to be a problem, you probably ought to get in and get it checked out.
And with that, I'm going to put up the numbers for Cross Keys Physical Therapy Sports Medicine Center because